All right, good evening, everyone. I'd like to call to order the April 27th full board meeting of the Community Mental Health Board. Everybody please rise for the pledge. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. It's officially 6 o'clock. I don't know what that was. Next up is reading of the mission statement by Brian.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next is adoption of the agenda. I'll take a motion to adopt.
So moved. Support.
Motion from Megan, support from Lori. Selena. All right. Questions, comments on the agenda? We got to separate you guys next time. All right. All in favor signify by saying aye. 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 All opposed? Agenda is adopted. Next is item 4, hearing of the public. Anybody from the public wishing to speak on any item on the agenda? Come on up. Give us your name and address. You have 5 minutes. And make sure the microphone is turned on. There's a little button on the bottom, on the base of it. There you go.
1, 2, 3. Good evening, everybody. My name is Kathy Swantek. I'm Executive Director for Blue Water Developmental Housing, and we have residential licensed homes in Macomb and St. Clair County. Thank you for allowing me to speak tonight. I want to let the board know that about a month ago, we permanently closed one of our Macomb County homes. It took a lot of deliberation to do that. We met with some of your staff before we actually made that decision. The sole reason for closing that home was not because there was nobody to live in the home. It was because we could not hire staff to provide the kind of services, the quality services that they deserve living in a licensed residential home. In January, our board actually increased our starting wage by $1 an hour, so our organization was able to pay $15.35 an hour. Of course, that includes the state pass-through. Even with that additional money that we were able to provide to starting wages for staff, we couldn't find the staff to staff that home. I know there are many providers in Macomb County that are experiencing some of the same issues. This staff shortage was not caused by COVID. It was exacerbated by COVID, but it's been a long time coming, and there is no end in sight. And the only way that we're going to be able to staff the homes that these people deserve to live in is by raising those starting wages. And it's got to be more than $15.35 an hour. So I'm here before you to ask you to please consider increasing per diems for residential providers so that we can do that. I appreciate, and we all appreciate, the 10% increase that you have provided to providers, but it's not keeping up with some of the counties that are contiguous to us. For instance, in St. Clair County, their average wage, or their average per diem, is about $276. That's an average. In Macomb County, the average for our organization is $128. With the 10% increase, that takes the average per diem here in Macomb County to about $140. We have calculated that in order to provide staff with just the $15.35 an hour that we need to start with, we need an average starting per diem of $199. Right now, our organization, and so I've got numbers here, and I don't have those all in my head, so I'm going to use a letter that I wrote to Dave, actually. Our employee vacancy rate is 33%. That means of 50 vacancies that are 50 staff positions that we have in Macomb County, 15 of those are vacant. They continue to remain vacant. We're trying very, very hard to get employees in. When we did raise the wage to $15.35 an hour, our applicants went from 27 a month to 70 a month. But we have 5 homes that we have to fill staffing vacancies with. Our turnover rate ending December of '21 was 6%. Turnover rate ending March '22 is 4%. So the turnover rate is going down. Our retention rate, which is, we're really striving to retain staff, because if we don't retain staff, we just are getting deeper in the hole. The more staff we lose, the more vacancies we have to fill. Our retention rate over the last 3 months has been 95%. So we're keeping staff, because when we increased that starting wage, we also increased people that have been with our organization for a period of time. So we really need a higher per diem. Right now, Blue Water Developmental Housing is not receiving reimbursement for that $1 an hour increase from Macomb County. We are from St. Clair County, and in fact, St. Clair County this fiscal year has also let us know that they're going to be providing a $2,000 retention bonus. That retention bonus, $1,000 was paid out in April, and another $1,000 will be paid out in September. And there's a cutoff date for employees so that they know if they don't stay with the organization, then they won't get that retention bonus. I would really, ask you to consider doing that. If you can't raise the per diems, that's another option. But I can tell you, if we aren't able to get reimbursed for the amount that it costs just to get staff in the door, many, many of us are going to have to turn the homes back over to you guys, and we hate doing that. We tried for 6 months to staff the home that we closed in March, and just were not able to do it. So thank you very much for the 10%. It's a start, but I would encourage you to really look at increasing those per diems, because other counties have been able to do that. Thank you. Appreciate it.
Thank you, Kathy. Anyone else from the public?
Hi, my name is Carmen Zimmerman. I live in Macomb County, but I also am a provider here in Macomb County through Creative Care Services in Clinton Township. I've spoke a couple different times here, and I'm going to keep coming and keep coming and keep coming so you can hear the voices from the providers. We're dying in Macomb County. We don't have the staff to provide to the families that we're supposed to be serving. Creative Care also, as Kathy said, Blue Water did, we went out on a limb. We're giving out some extra monies to our staff people, but it's not going to continue because we don't have that funding to do it. We're trying to keep the people that we're serving safe and where they need to be. So again, as Kathy said, thank you for the increase, but it's not enough. We've got to do better. Macomb's got to at least step up to match other counties. They're so far apart. So again, thank you for your time and listening to me, and I'll see you next month.
Thank you. Anyone else from the public? Anyone else? All right, we will close the first hearing of the public, and we'll move on to item 5, minutes. 5A, approval of the minutes of the CMH full board meeting on March 23rd, 2022. Take a motion to approve.
Support.
Motion from Linda, support from Lori. Questions, comments on this one? All right, all in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next, we will move on to item 6A, approval of the minutes of the nominating committee meeting held on April 25th, 2022. Take a motion to approve those minutes. Motion from Nick,
Support.
support from Lori. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Now I will turn it over to Lori, our nominating committee chair.
Yes, so we did have 3 people come forward that were nominated. Phil Kraft for chair, Selena Schmidt for vice chair, and Linda Bush for secretary treasurer. Are there any other nominations from the floor? Any other nominations?
All right, hearing none. Nick?
Yeah, Madam Chair, hearing no further nomination. I'll turn it on. Madam Chair, hearing no further nominations, I move that we suspend the rules and re-elect Phil Kraft Selena Schmidt and Linda Bush for chair, vice chair, and secretary treasurer respectively by acclamation.
Is there support for Nick's motion?
Support.
Support from Megan? Questions, comments? All right, hearing and seeing none. This is your last chance. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion carries. Thank you, Selena. Thank you, Linda. And thank you all. Next, we will move on to item 6B, approval of the minutes from the CMH Board Program and Budget Committee meeting on April 13th, 2022. Take a motion.
Support.
Who was the motion from? Motion from Antoinette, support from Selena. I'm trying to take notes since Sandy stepped out. Any questions, comments? Seeing and hearing none, all in favor signify by saying aye. Aye. All opposed? Minutes are approved. Next, we'll move on to item 7, request to approve. A, B, and C were all brought up during program and budget and discussed. Take a motion to approve them all if the board would like.
Support.
Motion from Donna, support from Megan.
Yep.
Questions, comments on any of these items? All right. All in favor signify by saying aye. Aye. All opposed? Motion passes. Move on to item 8, receive and file. No items there. Number 9, resolutions. No items there either. Item 10, voucher listings. I'll take a motion to pay the bills.
So moved. CFo Report.
Motion from Lori, support from Selena. Questions, comments on the bills? All in favor signify by saying aye.
Aye.
All opposed? Bills are paid. Now we'll move on to the CFO report just in time, I'm guessing. From Richard.
Give Sandy just a moment to pass those out for you. Sorry about that. We identified a little bit of a technical glitch in the items that were handed out previously.
Did you find more money, Richard?
No.
People are asking.
Sorry.
I tried, you guys.
All right. Go ahead and get started. So we do have our February monthly finance report, and I'll go through the typical highlights. On page 2 of the report, we have our revenue and our eligibility trend. So revenue is trending about even to last year. Again, last year we had a couple spikes because of the different points in time that the department did provide the DCW increase. So again, this year they're going to spread that out over the months. And actually we just received the new rates that will start for May. So as we mentioned, I think last month, the budget that was approved did have the DCW at $2.35 an hour, and we have been funding providers at the $2.35 an hour amount since October. However, because the rates are set by Milliman prior to the budget being approved last summer, it was only funded to us at the $2 an hour. So this is to make up for that 35 cents that we've been paying out, but we haven't been getting from the state. So we will see a bump in May when we get to that point in time for the financials. Eligibility, again, we're slightly above where we were last year. And as you probably have heard, the federal government did extend the federal emergency for an additional 90 days. So that was supposed to end here in April, and it's now been extended through July 15th of 2022. And so that also means that for our purposes, the 8.6% or so increase that was approved, again, just a reminder that will end 6 months following the end of that. So now that will extend into our fiscal year 2023, and we will take that into consideration as we build next year's budget. So just a couple highlights there on revenue and eligibility. Page 3, again, a lot of, as we look at our comparisons year over year, a lot more revenue this year. Again, not because our rates have gone up significantly, but we do have a lot of those eligibles that are on our rolls still currently, and we do expect that will reduce next year. Some of the estimates is that we could lose anywhere from 20 to 25% of our revenue next year when those individuals start to fall off. So we'll keep a close eye on that. So as a result of that, cash is high compared to the end of last year, about 40 million higher than the end of last year, and we do anticipate we're going to have to give some of that back to the state of Michigan. So in terms of then the income statement, we're still tracking relatively flat from year to year. So again, a lot of this is one-time money that we're getting in from the additional eligibles, and we want to be careful not to create programs that may not be sustainable long-term or that we would have to significantly cut. So that's something that is in our that we are paying attention to. Page 5 is our summary of revenues and expenses by category. So through February, our Medicaid was approximately $25 million in surplus. Autism was just over break even, about $40,000 surplus. Healthy Michigan is just under $6 million in surplus, and our state general fund about $2.4 million. And then at the bottom of that page, the beginning balance for our ISF and savings, total reserves there about $37.6 million. We think we'll get to put a little bit of our current year surplus in there, again up to our contractual limit, ending around $37.8 million in reserves. So the nice thing is, so when those eligibles do fall off and our revenue is reduced, we will have that to help cushion that and not have to potentially cut back as quickly. So we'll keep that in mind as we move forward. So those are the highlights for February's financials. I will say that as I come forward in the next couple of months, we do plan on adding the CCBHC reporting to this packet. We're still waiting for guidance from the state of Michigan on how all of that funding and cost settlement will work with them. So that is still pending from the department. But when we get there, we will incorporate those into these reports and then be able to share our progress with CCBHC. So.
Thanks, Richard. Linda, go ahead.
I don't know if this is for you, Richard, or for David. Thanks for your report. You indicated when you were speaking about the difference in the $2 and the $2.35, you used the wording, we're only funded by, I guess, DHS by the at the $2 rate. What I'm not understanding with all the people who come and talk to us about surrounding counties paying a different amount, are they funded at a higher level? And what would be the criteria used for that, if that's true?
So I don't want to speak on behalf of other counties, but my understanding is all counties for the DCW portion are funded at the same amount. And if they're choosing to do something over and above that, then they must be using some of their other Medicaid funding available for some of those other programs. That would be my understanding. So.
Okay, so for Dave, can we find out what they're using?
I can ask.
Okay.
Linda, are you all set?
Yes,
Nick?
thanks, Richard.
Nick, go ahead.
Well, again, I'm not sure I know who the question should go to, whether it's Dave or Richard, but if they're using Medicaid funds, are they using one-time monies, or are their Medicaid rates that significantly different than ours? I know the Millman rates are supposed to be actuarially sound. So I guess when I hear, as we heard testimony, of such a large difference, I understand smaller difference, but such a large difference in residential reimbursement rates from neighboring counties, we're all funded the same way. We're all funded Medicaid, autism, and we're all funded on the basis of the number of eligible Medicaid recipients in the county. And unless the percentage of eligibles that are utilizing their system is substantially lower than ours, which would be one explanation, I suppose. I'm perplexed. I'm trying to figure out why there is such a huge difference in reimbursement rates.
So you're correct. So to answer your question, they could be, there are differences in what every region gets paid based on the actuarial studies in the past. And so each county does get a different reimbursement amount per eligible. So that is, could be part of it. But it is also true that every region is getting some of this one-time money with the extra eligibles. So that's a statewide phenomenon, not just for us. And so they could be using some one-time money. That could be part of what they're doing.
And David, we have been concerned for some time about penetration rate, that there are a lot more people who are eligible for services than utilizing it. Do we know how that compares with neighboring counties? Are they able to pay more because less people are using their services of those that are eligible? That's one of the problems with the capitated
No, I
system.
don't think that's the case.
You don't think that's the case?
No, and our penetration rate does continue to be a concern. I haven't seen the current numbers, but yeah, historically, our percentage has been the lowest, or pretty much the lowest for a considerable amount of time.
So our penetration rate is lower, which means
We're
that's
seeing.
bad for other reasons, but in terms of the
Yeah,
amount
it's
of
a
money we
calculation
have.
of active people divided into the Medicaid eligibles in your county or region.
Right, but what I'm saying is, though that's a concern for other reasons, in terms of how much money we have per person actually using services, that increases that amount per person, because we're paid on the basis of how many are eligible to receive, not how many actually use the money. So that, maybe we need to form, a work group of some sort to look at, think about with staff and maybe some board members, to try to figure out what's going on, what the problem is, so that we can talk to either the legislature when they're developing the Millman reports, which we've done in the past, because they really shorted us for several years. I thought that was pretty much taken care of now. Or look at some other, if we don't know what the problem is, it's pretty hard to suggest a way to fix it. Just a suggestion.
Thanks, Nick. Any other questions, comments for Richard or Dave about the report?
Just to add a little bit for you, Nick, we do have our, recently got notification that we'll have our next rate setting meeting with the department in May. So it may be timely that we could start bringing some of that information of what Milliman is planning on for next fiscal year and how they're going to set the rates, and maybe we could do some sort of a educational workshop or something. Yeah.
When Millman looks at setting the actuarial rates, are they looking at just the total, or are they looking at the component pieces, like overhead, residential, non-residential,
So I don't think they're going to change their methodology significantly this year, but in the past, they do get really, really detailed. So they do a regressive analysis all the way down to specific cohorts, how many services are being used in each region by certain demographics, and then they try to estimate what, if you trend that forward, what the cost of service would be in the future. So I know it is very detailed, and as a result, we do have a decent rate variation by region because of that significant analysis, but it is very detailed.
Yeah, and David, I think you'll agree with me when I say I agree with the lady, that the staffing problem in residential was there before the pandemic. The pandemic greatly exacerbated it, but it was coming anyways. Are we seeing similar staffing problems in other than residential programs? Yeah, I thought we were. I just wanted to verify that.
Thanks, Nick. Anyone else? Okay. Thanks, Richard.
Thank you.
Next, we will move on to the CEO update.
Well, I'll go out of order a little bit on my items here now. After the last board meeting, Phil had asked for a summary of the rate increases that we've done to date. I did share that with him, and I owe that to the rest of you all. So I'll be getting that out, and then we'll be keeping that spreadsheet current as items like the DCO rate differential that was just approved. We'll add that on there. So we have done the 8.62% across the board for outpatient services. We did the 10% increase for residential. You just approved, thank you, the 10% rate differential for the designated collaborating organizations. We did a hospital rate per diem increase, and then another hospital rate increase specific to our My Health Link program. Also expected later this year, the fiscal year, the state's coming out with a tiered rate system for the hospitals that we'll have to implement as well. So there'll be some more contract rate changes on the hospital side. The provider stability payments continue. And also in the pipeline now, you can expect these to come to the board next month. The evaluation and management codes for the psychiatrist, we're looking at increasing those to allow to assist with the shortage of psychiatric services in our system. And we're also, we've looked internally, and we have a planned rate increase with the supporting detail that will be coming forward for community living supports and respite. So you'll have that next month. We also, thanks to Kathy, we had a discussion today about generators for some of our homes. And we got some clarifying language out to our providers. In some cases, a lot of cases, it makes sense to provide the financial support to get a generator in the home, especially if there's medically fragile individuals. If there is a power outage for any reason and people need to be relocated, all of our providers are required to have an evacuation plan, which is typically a hotel. But you can imagine that creates a number of problems, and it's stressful for everybody involved. So if we can keep people in place for hopefully short periods of time. So we are considering that as, for coverage as well, and that went out to our providers. So along with those rate increases, I will get you the provider stability payment summary that we track monthly, and then you'll get the additional things that we have planned as well. The switching topics now, today is Administrative Assistant Day. So I do want to acknowledge all of our administrative assistants, present company excluded. No, we greatly appreciate our administrative assistants, and it was very nice being in the office today. There was lots of nice celebrations and acknowledgments that really you all know Sandy runs the place, and she keeps me in line and in track. So yes, they are a huge part of the ongoing and daily services. So we do appreciate their efforts. We also were notified on the good news front. Our certification was approved for our CCBHC demonstration project officially at the state level. So the state had given out provisional certifications early on in the process, pretty much to give themselves time to look at everybody's information. We did submit very specific, detailed, and they responded with asking us to clarify some of that, which we did, and we got the final official approval. So again, just a big thank you for the staff involved with that. Definitely a team effort, but we do have some staff pretty much dedicated to that effort, and they're doing really good work.
I just want to mention, Dave gave a really good report to the CAC this month and detailed some of the success stories and the outcomes for CCBHC. And members of the CAC who've been there a long time were like, oh, this is way better than the last report you gave a year ago. So they've really stepped up, and the people served on the CAC appreciated the report.
Thank you. Jail diversion. Kind of a broad update on that. We did, as the board approved us to issue the RFP. The committee has met. They have selected a vendor, but as that process was moving forward, there was other efforts and conversations at the county side, some of it involving the opioid settlement dollars. So we did have a meeting. Helen and I met with Vicki Roble and Ernest from the Macomb Community Action and Andrew Cox from the Health Department, and started having conversations. It's morphed into something that we definitely need to clarify, but there's good energy and there's funding available now. So we are looking at specific models that do touch on crisis stabilization, the jail diversion, including the specific models that we can use to implement that. So we are scheduled to meet again next week as a follow-up. I'm pulling additional information together. I'll keep you posted, and I'm happy to answer any questions on that. But there's also, I guess I'll leave it at that right now. It'll be an effort, but it's a lot of good energy, and I think the timing is right to hopefully stand something up for Macomb County that really has a long-term impact on our communities. I guess I'll end my report on that note. Happy to answer any questions, and I will follow up on the other comments. Thank you.
Thanks, Dave. I don't see any, but Lori.
Yeah, I just want to again tell Sandy congratulations and how much work you do, not only for in the office, but for each and every one of us, and how many emails we get and keep us on our toes. I want to thank you, and on behalf of the board, we did present Sandy with a little token of our appreciation today.
All right. Any other possible agenda items from any other board members? Megan?
Can I just say something at this point? I just wanted to,
I don't have the power to shut your microphone off, so go ahead.
Come on. So next week, starting from May 1st to May 7th, is Public Service Recognition Week, or PSRW, and it's been around since 1985, and it's a recognition of our federal, state, county, local, tribal government employees. And I just wanted to say happy Public Service Recognition Week to all of our public employees. Thank them for all of their service, and if you are not a public employee yourself, just give one a squeeze when you see one, because they do a lot. So thank you to all the fellow public servants.
If I could. I saw something on your LinkedIn page.
Yes.
Care to comment?
Yes. So last night, Ryan Fantuzzi and the amazing Tracy Smith and I gave a presentation to ASPA, the American Society for Public Administration, for their Detroit chapter, and we did it on mental health in the workplace. It was much like the one that you and Tracy did for MPELRA, but it was really great, and honestly, we got really good feedback. We were able to do it on Zoom seamlessly somehow. It's hard to present and not be able to look at the person you're presenting with, you know? So I actually hid everybody else's video and just looked at Tracy and Ryan and pretended like it was just the three of us talking. But it actually was amazing, and a huge shout out to Tracy because she's amazing. They got a lot out of it, and we really got like quite a bit of praise. So that was wonderful, and we're just trying to spread the word and end the stigma.
For the record, I've done that presentation twice with Tracy, and now she's just left me aside. Now she's in the big leagues with the board members, and I'm sure it was a much better presentation without me being involved. But thank you, Tracy. And Megan and Ryan.
Yep, thank you, all three of you. Anyone else? I have two things real quick. Tomorrow, the Board of Commissioners is voting to approve a new HR director for the county. She has been with the county for a very long time, and I actually ran into her in the parking structure a couple weeks ago, and we started talking about CMH and the issues we're having with staffing, and she wanted to meet with me right away, so we met on Friday. It's a very good meeting, opening that conversation, so hopefully we're headed in the right direction in terms of that. She has a lot to wrap her head around. CMH specifically, we've lost two of her higher up people, so that's slowing us down a bit, I guess, but she is working on that and she's willing to work with us, so that should be positive.
What's her name, Phil?
Carlin Semlo, I think that's how you say her last name. She's been here for 20-some years. And then on another note, I do crack my jokes and stuff, but I do take this position seriously, and I want to thank all of you for giving me the opportunity and the honor to serve again for another year. It's been a tough year, and moving forward, I'm sure we have some more obstacles and obviously more things to tackle, so I'm looking forward to doing that with all of you. I'm blessed to have a great board, so I wanted to thank you all again for that. Anyone else before I turn it over to hearing of the public? All right, hearing of the public. Sean.
Good evening, I'm Sean McGregor. I'm with CEO, just to give our monthly report. At our Anchorville program, they attended the Shrine Circus and made popcorn back at the building. They dyed eggs for Easter and had an Easter party with egg salad sandwiches. They also had groups go bowling. At our Washington location, they delivered over 240 Meals on Wheels and raised almost $500 for their second annual Breakfast with the Easter Bunny. Their community outings are utilizing malls, nature centers, craft hobby stores, theaters, and bowling alleys. And then as well, CO and myself would like to congratulate and recognize Brian Zajac for being the newest member of the board. And then as well, we have a little packet we would give to anybody who's new that starts our company, just a little info about us. And then as well, looking forward, June 20th to the 24th, we're going to be having a summer camp. And then lastly, again, we'd like to just express our gratitude for the 8.6% you guys gave, so thank you.
Thank you, Sean. Anyone else from the public?
Good evening. My name is Zach Cardinell. I am the board president for AMORC, the Association for Macomb and Oakland Regional Center. And I wanted to first introduce myself mainly because I've spent my career in Oakland County, so a lot of the Macomb County things are very fresh to me, so I'm very excited to learn. And luckily over the years, I've been able to sponge up some of Mr. Pankatai's information and knowledge. One other thing I want to mention, though, a lot of the folks are talking about staffing issues, and as a former provider myself, I wanted to just point out, in case any board members aren't really aware of kind of a byproduct of the staffing issue is the wait list problem that continues to happen at almost every agency at this point. And one of the things that I am trying to tackle, especially if you're unfamiliar with AMORC, it's a parent group that started in 1975. It was really instrumental in bringing folks out of institutions and getting them into communities. This past few years for AMORC, and a big reason why I stepped in was because technology was becoming a huge issue for a lot of those members and a lot of people at the organizational level. And so we've seen a big drop off, and one of my missions is to get younger parents involved. The problem is we're getting younger parents involved when their children are 26 years old, and it's far too late. And they're coming out of the school system very confused. Why is this such a different system? Why weren't we prepared for this? Those types of things. So one of the suggestions I've been making to various boards around the state at this point is to consider connecting with the school districts and having some sort of flow of information. I'm sure that's already happening at some level, but I just feel an obligation to bring it up to board members for your advocacy efforts in that region as well, because they're clueless. I mean, I'm sure you all know, being part of the board, that they're clueless, and it's really sad. And we're seeing that, again, there's no staffing, so they're just stuck at home, and it just snowballs. And so I just wanted to mention that and introduce myself. So thanks again for your time. Have a good night.
Thank you for being here. Anyone else? Tracy? No? Okay. Caught her off guard. We will close hearing of the public, and I'll take a motion to adjourn. Megan, Linda, all in favor? We are adjourned. Thank you, everyone.